something I've been observing in my practice for years, something that has made me rethink many of my understandings of the human mind. Did you know that there are people who have lived their entire lives feeling different, misunderstood, exhausted after social interactions, and who only discover they have autism in adulthood? And we're not talking about isolated cases. We're talking about thousands, perhaps millions of people who have navigated the world without an instruction manual that everyone else seemed to have. Welcome to the Living Mind channel. Today I want to share with you what no one tells you about autism. I'm not going to talk about the stereotypes you see in movies or the cases that appear in the media. I'm going to talk about the reality I see every day in my practice, about the tears of relief when someone finally understands why they always felt like an alien on their own planet. I'm going to talk about autism in women that often goes unnoticed, about the exhaustion that no one sees, about the brilliance hidden behind what some call a deficit. But above all, I'm going to talk to you about something fundamental. Autism is not an illness that needs to be cured. It's a different way of processing the world, of feeling it, of experiencing it. And when we understand this, everything changes. It changes for the autistic person. It changes for their family. It changes for society. So I invite you to set aside everything you thought you knew about autism and join me on this journey toward a real, deep and honest understanding of a condition that affects more people than you imagine. When most people think of autism, the image of Dustin Hoffman's Rain M counting toothpicks comes to mind, or they think of a child rocking in a corner who doesn't speak, who doesn't make eye contact. And yes, those are manifestations of autism, but they represent only a small fraction of the autism spectrum. The key word here is spectrum, and it's crucial that we understand it. Autism spectrum disorder, or ASD, is precisely that, a very broad spectrum of manifestations. There are autistic people who are university professors, doctors, engineers, and renowned artists. There are people who have partners, children, and lives that, from the outside, seem completely normal, but inside, their experience of the world is radically different. In my practice, I've seen high-level executives who arrived after years of feeling exhausted, of not understanding why social gatherings drained all their energy, of wondering why they needed very specific rituals to function. I've seen brilliant mothers who raised their children wonderfully, but who felt they were constantly acting, following a script they had learned, but which didn't come naturally to them. Autism is characterized by two fundamental aspects. First, differences in communication and social interaction. This doesn't necessarily mean that the person doesn't want to connect, or that they can't, but rather that they do so differently. The implicit social cues that the rest of us automatically pick up on can be like a foreign language for an autistic person, something they have to deliberately learn. Imagine having to consciously translate every gesture, every tone of voice, every facial expression each day. Having to calculate how long it's appropriate to maintain eye contact when it's your turn to speak. Whether that person is being sarcastic or literal, it's exhausting. And this brings me to something crucial that most people don't understand. Many autistic people aren't incapable of reading other people's emotions. They have to do it manually, consciously, while for the rest of us it's automatic. The second aspect is restricted and repetitive patterns of behaviour, interests and activities. This can manifest in 1,000 different ways. It might be someone who needs to eat the same thing every time, who becomes deeply distressed if their usual route is changed, or who has such an intense interest in a specific topic that they can talk about it for hours. But it can also be more subtle, needing a very structured routine to feel safe, having very pronounced sensory sensitivities, or finding deep comfort in certain repetitive movements or activities. And here's something fundamental. These characteristics are not whims or quirks. They are the way the autistic brain manages a world that overwhelms it. Routines provide security in a chaotic world. Intense interests are islands of calm and understanding in an ocean of confusing stimuli. Repetitive movements, what we call stereotypies, help regulate a nervous system that is constantly on high alert. Before we continue, if you're finding this content valuable, I invite you to subscribe to the channel and like this video. Creating content that truly helps people understand mental health and how our brains work is my passion, and your support allows me to continue sharing these insights with you. Also, when you subscribe, YouTube helps me reach more people who need to hear this, people who may have been feeling different for years and don't know why. So, if what we're talking about resonates with you, that simple act of subscribing can change someone else's life. Now I want to talk to you about something that I'm both passionate about and concerned about: autism in women. For decades, autism was diagnosed primarily in men, with a ratio of approximately 4 boys for every girl. But do you know what we're discovering now? It's not that there are fewer autistic women, it's that we've been looking in the wrong place. Autistic women are masters of camouflage. From a very young age, they learn to imitate, to copy, to create a social mask that allows them to go unnoticed. They observe popular girls and replicate their gestures, their ways of speaking, their interests. This is what we call masking, and it comes at a very high cost. I've had women in my 40s and 50s in my practice who tell me, "Doctor, all my life I've felt like an actress, that I'm constantly playing a role, that there's a disconnect between what I show and what I feel." And when we delve deeper, we discover that they are autistic, but they have developed such sophisticated compensatory strategies that no one, not even they themselves, had identified it. Autistic girls often have intense interests, but many times these interests fall within what is socially acceptable: animals, books, television series. The problem isn't the interest itself, but the intensity. While other girls read Harry Potter, the autistic girl reads it 20 times, memorizes every detail, can recite entire passages, but because the subject matter is acceptable, no one sees it as a red flag. Furthermore, autistic women are often more capable of maintaining friendships on the surface. They may have a couple of close friends, they may go to parties if necessary, they may function socially, but what no one sees is the cost. The profound exhaustion after a social event, the need for entire days of solitude to recover, the internal crises that no one perceives because they have learned to maintain the facade until they get home. And here lies the most serious problem. Many of these women don't receive a diagnosis until adulthood, frequently after one of their children has been diagnosed, and they recognise themselves in the criteria. By then, they have accumulated years of anxiety, depression, eating disorders, and self-esteem issues. They have undergone multiple therapies that treated the symptoms, but not the root cause. Late diagnosis in women is a public health problem that almost no one talks about, because it's not just about putting a name to something. It's about these women finally understanding why they always felt different, why things that seemed easy for everyone else took so much effort for them, why they needed structures and routines that others found excessive. Let me tell you something that many people don't know. For an autistic person, the world can be literally painful. And I'm not talking about emotional pain. I'm talking about physical pain, sensory overload, which is unbearable. The autistic brain processes sensory information differently. What might be manageable background noise for you can feel like someone is setting off an alarm right inside their head. A t-shirt tag that you don't even notice can feel like sandpaper on their skin. The fluorescent lights in an office that you barely perceive can feel like constant flashes that make it impossible to concentrate. I've had patients tell me that going to the supermarket is a traumatic experience. Bright lights, background music, announcements over the PA system, other people's conversations, mixed smells, the texture of the shopping cart. All of these bombard their nervous system simultaneously. It's not that they're weak or overly sensitive. Their brain literally can't filter these stimuli the way ours can. Think of our brain as a bouncer at a nightclub. In a neurotypical brain, the bouncer lets in only relevant information and filters out the rest. If you're in a coffee shop chatting with a friend, your brain automatically lowers the volume of other conversations, clinking plates and background music. But in the autistic brain, that bouncer sometimes lets everything in at once with the same intensity. It's like trying to hear a conversation in a packed stadium where all the voices are the same volume. This sensory sensitivity can manifest in many ways. There's hypersensitivity, which is what we just described, where the stimuli are too intense, but there's also hypersensitivity, where the person needs very intense stimuli to feel anything. That's why some autistic children constantly seek intense movement, deep pressure, or have a seemingly very high pain tolerance. And here's something crucial: stereotypies. These repetitive movements that people sometimes see as strange are often mechanisms of sensory self-regulation. Rocking, hand flapping, humming. These are all ways the autistic brain tries to manage sensory overload. They aren't behaviours to simply eliminate. They're survival strategies. I remember a young patient telling me, "Doctor, when I go outside, it's like all my senses are amplified to the maximum. I see every detail, hear every sound, smell every scent. At the end of the day, my brain is so saturated that I can only stay in my room, in silence, in the dark, for hours." and society told her she was antisocial, that she was weird, when in reality her brain simply needed that recovery time. Now I want to talk about something fascinating about communication in autism. Autistic people tend to communicate much more literally than the rest of the population, and this constantly leads to misunderstandings. Imagine someone says to you, "Can you pass me the salt?" Most of us understand that it's an indirect request, that it really means "pass me the salt, please." But an autistic person might respond literally, "Yes, I can," without moving to pass the salt. Because the question was whether they could do it, not whether they would. Or think about expressions we use all the time. "I'm starving," "It's freezing," "I was drooling." For someone with literal processing, these phrases can be confusing or even disturbing. "They're not starving, they're not drooling, there's no drooling." Why are you saying something that isn't true? Sarcasm is particularly tricky when you say, "What a beautiful day," in the middle of a storm with a sarcastic tone. You're hoping the other person will understand that you actually mean the opposite. But that requires reading tone, context, facial expressions, all simultaneously. For many autistic people, this is like solving a complex puzzle every time someone speaks. And here's the interesting part. Autistic communication isn't inferior. It's different. In fact, in many ways, it's superior. Autistic people tend to be extraordinarily honest, direct and clear. They say what they think, without unnecessary filters, social games, or manipulation. If an autistic person tells you they like you, you can be sure it's true. If they tell you something is bothering them, they're not being dramatic. It's genuinely bothering them. The problem arises because we live in a society where indirect communication is the norm, where you're expected to read between the lines, pick up on hints, and understand what someone really means, even if they don't say it outright. And this puts autistic people at a constant disadvantage. I've seen in my practice how this affects relationships. An autistic woman told me that her partner would get angry because she didn't understand when he wanted them to leave a meeting. He would glance at her, make subtle comments about how late it was, but never directly say, "I want to leave." And she, processing everything literally, didn't understand until he exploded in frustration. But I've also seen the other side, couples where the neurotypical partner learns to communicate more directly and clearly, and suddenly the relationship flourishes. Because eliminating ambiguity isn't bad. It's liberating for both parties. Now I want to take you to one of the most beautiful aspects of autism, special interests. And yes, I say beautiful, because when you understand what they truly are, they cease to be a rarity and become a window into a form of passion that many of us have lost. Special interests in autism are areas of intense, deep, almost obsessive focus. It can be anything. Dinosaurs, astronomy, a specific historical period, a type of music, mathematics, programming, how household appliances work, you name it. But the defining characteristic is the intensity. While a neurotypical person might have a hobby they enjoy, an autistic person can immerse themselves so deeply in their special interest that they become an expert in the subject. They might spend hours, days, years exploring every aspect, every detail, every connection. And this isn't compulsion or obsession in the pathological sense. It's pure love of knowledge. I've known 8-year-olds who knew more about astronomy than many university students, teenagers who could explain the entire history of jazz in astonishing detail, adults who became the world's leading experts in very specific areas simply because their special interest led them down that path. And here's the key. Special interests aren't just a pastime. They're an emotional need. They're the safe haven where the autistic person can be completely themselves, where everything makes sense, where there's no ambiguity or social confusion. They're islands of peace in a chaotic world. Moreover, these interests are often the foundation for great careers and contributions to society. Think of the great scientific breakthroughs, the technological innovations, the works of art that have changed the world. Many of these individuals come from people with autistic traits who were able to channel their capacity for intense focus into something productive. Temple Grandin, probably the most famous autistic person in the world, revolutionized the livestock industry by applying her unique way of thinking in images. Her special interest in animal behavior and her deep empathy with them led her to design more humane systems. And what if she had been told it was strange for a girl to be so interested in cows and forced to change? But I've also seen the dark side. Families who try to cure these interests, who see them as something negative that must be eliminated, therapies that seek to make the child more normal by suppressing what they love most. And this is profoundly harmful. Special interests should be respected, celebrated, even used educationally. If a child is obsessed with dinosaurs, we can teach them reading with dinosaur books, math by counting dinosaurs, geography by exploring where they lived. Their interest is the gateway to learning, not the obstacle. I want to talk now about something that is absolutely crucial to understand, and that is often the most debilitating aspect of autism: autistic burnout. Imagine that every social interaction, every task that requires flexibility, every sensory stimulus you have to process, consumes an enormous amount of energy. It's not that you're being lazy or exaggerating. It's that your brain is literally working twice as hard as a neurotypical person's to achieve the same result. Autistic people, especially those who have learned to mask their traits, live in a state of constant hypervigilance. They are constantly monitoring their behaviour, their responses, their facial expressions. They are translating social language in real time. They are regulating sensory responses that are overwhelming for them. All of this happens every second of every day, and there comes a point where the system collapses. This is what we call autistic burnout, and it's different from the job burnout we all know. It's deeper, more devastating, and can take years to recover from. I've seen young adults who had successful careers, who were seemingly functioning well and then suddenly collapse. They can no longer do things they once did routinely. They lose skills they had acquired. They can no longer tolerate the sensory stimuli they used to handle. Social demands become impossible, and this is often misdiagnosed as depression or anxiety. A patient told me, "Doctor, it's like my brain is in a foreign language, and for 30 years I managed to translate quickly enough that no one noticed it wasn't my native tongue, but now I can't anymore. The words just won't come out. The translation doesn't work, and everyone looks at me wondering what happened." That's burnout. Warning signs include a loss of communication skills, increased emotional breakdowns, heightened sensory sensitivity, an inability to tolerate changes they previously handled well, an extreme need for solitude, and a profound sense of being overwhelmed by things that were once manageable. And here's the critical point. Recovery from autistic burnout requires a completely different approach than treating traditional depression. It's not about pushing the person to go out more or stay active. It's about the exact opposite, allowing the nervous system to rest deeply, removing demands, and respecting the need for solitude and routine. This is especially complicated for adults with work and family responsibilities. How do you tell your boss you need 3 months off? Not because you're sick in the sense of, not only because of the traditional language, but also because your brain needs to recover from years of translating a language that isn't its own. Now I need to talk about something that can be frightening if you don't understand it, but that makes perfect sense when you do. Meltdowns, or autistic meltdowns. A meltdown isn't a tantrum. It isn't manipulation. It isn't a lack of discipline. It's a neurological response to an overload of the system. It's like when you overload an electrical circuit and the fuse blows. The meltdown is the fuse blowing to protect the brain from further damage. This can happen for many reasons: accumulated sensory stress, too many social demands, unexpected changes in routine, frustration at not being able to communicate something, or simply the last straw after a day of keeping up appearances. During a meltdown, the person may scream, cry uncontrollably, hit themselves, or exhibit behaviours that seem aggressive. But here's the key point. They aren't choosing to do this. They aren't in control. The nervous system has taken over and is in pure survival mode. I've worked with families where parents tell me, with tears in their eyes, how their teenage son, who functions perfectly well in public, comes home and collapses. How can he, after a day at school, need an hour to cry, scream, or simply be in his room in complete darkness? And they tell me, "Doctor, the teachers don't believe us when we tell them. They say he's fine in class, that we're making up problems." What these teachers don't understand is that being okay in class is taking up all his available energy. The child is holding it in, containing it, masking it, and when he gets to his safe space, to his home, he can finally let down all those defences. And that looks like a meltdown. What do you do during a meltdown? The first thing is to understand that you can't reason with someone who is in the middle of a sensory meltdown. The prefrontal cortex, the rational part of the brain, is offline. Trying to talk, give explanations, ask them to calm down, only makes things worse. What helps is reducing stimuli, dimming the lights, eliminating noise, giving physical and emotional space, avoiding intense eye contact, not touching unless the person requests it, and simply being calmly present. It's like waiting for a storm to pass. You can't stop it. You can only seek shelter and wait. There's also shutdown, which is the opposite of mellow. Instead of an external outburst, there's an internal shutdown. The person becomes nonverbal, unable to move, and dissociates. Both are valid responses to overload, and both require the same respect and understanding. And now we come to something fundamental, something that shifts the entire paradigm. Autism is not a disease to be cured. It's a neurological difference, a different way of processing the world. And when we stop seeing autism as something to be fixed and start seeing it as a natural variation of human diversity, everything changes. For years, the medical approach has been to try to make autistic people more normal. Intensive therapies to suppress stereotypes, to force eye contact, to eliminate special interests. And yes, some of these therapies have helped develop useful skills, but many others have been deeply traumatic. Imagine being told from a young age that the natural way your body wants to move is wrong, that the kinds of conversations you enjoy are inappropriate, that the things you're passionate about are weird, that the way you perceive the world is flawed. How would that affect your self-esteem, your sense of identity? I've heard testimonies from autistic adults who went through intensive therapies in their childhood and describe experiences of abuse, of deep trauma from being forced to suppress who they were. And this breaks my heart because these therapies were done with the best intentions, by parents who loved their children and wanted the best for them. But what if we change the approach? What if, instead of trying to change the autistic person to fit into a neurotypical world, we change the world to be more inclusive? What if we taught useful skills without trying to suppress autistic traits? For example, we can teach communication skills without forcing eye contact. Many autistic people concentrate better when they don't have to make eye contact, because looking into someone's eyes consumes cognitive resources they need to process the conversation. Allowing them to look away while speaking isn't disrespectful. It's accessibility. We can accept stereotypes as legitimate forms of self-regulation instead of trying to eliminate them. If someone needs to wave their hands when they're excited, why is that a problem? It's their way of expressing emotion, just as valid as ours, like smiling or jumping for joy. We can design educational and workspaces that are sensorially accessible, with adjustable lighting, quiet rest areas, and flexible schedules that allow people to work when they're at their best. The neurodiversity model invites us to see autism not as a deficit, but as a difference. Yes, there are real challenges. Yes, many autistic people need support in different areas, but there are also incredible strengths. Exceptional focus, detailed and precise thinking, refreshing honesty, profound loyalty, and unique perspectives that can solve problems in ways neurotypicals would never consider. I want to dedicate some special time to discussing diagnosis in adults, because it's something I see more and more in my practice, and I believe it's vitally important. Many people reach their 30s, 40s, even 50s, and only then receive an autism diagnosis. And when I ask them how they feel about the diagnosis, the answers are almost always the same: relief, validation, and also pain for all the years lived without understanding. The typical process is this. The person has spent years, perhaps decades, feeling different. They've accumulated diagnoses that never quite fit: social anxiety, depression, personality disorder, attention deficit disorder. They've been to multiple therapies that address symptoms, but never got to the root cause. Then something happens. Perhaps they read an article about autism in women and see themselves reflected in every line. Perhaps their child is diagnosed, and upon reading the criteria, they realise they describe their own experience. Perhaps a perceptive therapist finally connects the dots, and when they arrive at a diagnosis, when they can finally put a name to a lifetime of experiences, something profound shifts. It's not that they are different now. They were always autistic, but now they have the instruction manual. Now they understand why things that were easy for others were so difficult for them, why they needed certain structures that others found rigid, why the world seemed more intense, more demanding, more exhausting. A 42-year-old patient told me, "Doctor, all my life I thought I was weak, that I wasn't trying hard enough, that there was something fundamentally broken inside me. Now I understand that my brain works differently, that I wasn't broken, that I was just trying to function in a world that isn't designed for me. It's like having been trying to fit a square peg into a round hole for 40 years and finally realising that the peg is perfect. I just need the right hole." The diagnosis in adults also brings challenges. There's a grieving process for a life that could have been different, if they had had this knowledge earlier. There's anger sometimes about all the years of unnecessary struggle. There's a rebuilding of identity incorporating this new understanding. But there's also liberation. Liberation to finally be able to be authentic without feeling like there's something wrong with it. Liberation to be able to ask for the accommodations they need without feeling ashamed. Liberation to connect with a community of people who understand exactly what they're experiencing. And here I want to make an important appeal. If, upon hearing this, you've felt a connection, if you've been thinking to yourself, this is me. It perfectly describes your situation. Consider seeking an evaluation, not because autism is something that needs treatment, but because understanding is power. Knowing why you function the way you do allows you to make more informed choices about your life, your work, and your relationships. The diagnostic process in adults can be complicated. Many professionals still have a stereotypical view of autism and may not recognize it in someone who has developed sophisticated compensatory strategies. Seek out professionals who have specific experience with autism in adults, especially if you are a woman. And crucially, self-diagnosis is widely respected in the autistic community. If you have researched thoroughly, if you recognize yourself in the experiences of other autistic people, if this understanding helps you live better, then it's valid. Not everyone has access to qualified professionals or expensive evaluations. Self-understanding shouldn't be behind a financial barrier. Now I want to delve into a particularly sensitive, yet absolutely crucial area: romantic relationships when autism is involved. And here, I can talk about relationships where one person is autistic and the other neurotypical, as well as relationships between two autistic people. Empecemos con algo hermoso. Las personas autistas aman profundamente. De hecho, muchas veces aman con una intensidad, una lealtad y una honestidad que es extraordinaria. No juegan juegos sociales en el amor. Si te dicen que te aman, lo dicen literalmente, sin segundas intenciones ni manipulaciones. Pero las dificultades aparecen porque el lenguaje del amor puede ser radicalmente diferente. Las personas neurotípicas esperamos ciertas señales de afecto, miradas significativas, palabras románticas dichas en el momento perfecto, gestos espontáneos de cariño, y una persona autista puede expresar amor de formas completamente diferentes. He visto en mi consulta parejas al borde de la separación, donde el problema fundamental era de traducción. La pareja neurotípica se quejaba: no me demuestra amor, nunca tiene detalles románticos, no me mira con cariño. Y cuando hablaba con la persona autista, descubría que estaba expresando amor constantemente, pero en su propio idioma. Por ejemplo, una paciente autista me explicaba que ella demostraba su amor preparando el café exactamente como a su pareja le gustaba cada mañana, investigando profundamente sobre los temas que le interesaban para poder conversar con él, organizando su espacio de trabajo de la manera más eficiente posible. Para ella eso era amor en acción, pero su pareja interpretaba estas acciones como funcionales, no románticas. O pensemos en la necesidad de tiempo a solas. Muchas personas autistas necesitan periodos significativos de soledad para recargar. Esto no es porque no amen a su pareja o porque prefieran estar solos. Es una necesidad neurológica real, pero la pareja neurotípica puede interpretarlo como rechazo, como falta de interés, como distanciamiento emocional. La comunicación directa se vuelve absolutamente esencial. Esas indirectas, que funcionan en relaciones neurotípicas, simplemente no funcionan aquí. Si necesitas algo, hay que decirlo explícitamente. Si estás molesto, hay que explicar exactamente por qué. Si quieres afecto físico, hay que pedirlo directamente. Y esto, curiosamente, puede llevar a relaciones excepcionalmente honestas y transparentes. No hay espacio para malentendidos cuando ambas partes aprenden a comunicarse con claridad total. No hay juegos de poder porque la persona autista simplemente no participa en ellos. Las relaciones entre dos personas autistas tienen su propia dinámica. A menudo hay una comprensión profunda e inmediata. Ambos entienden la necesidad de rutinas, de tiempo a solas, de intereses intensos. Ambos valoran la comunicación directa. Pueden existir juntos en silencio, sin sentir que hay algo mal, pero también pueden surgir desafíos cuando ambos están sobrecargados sensorialmente o emocionalmente al mismo tiempo, cuando ambos necesitan espacio simultáneamente, cuando ninguno de los dos tiene la energía para mantener la estructura del día a día. Un aspecto que me parece fascinante es cómo las personas autistas experimentan y procesan la intimidad física. Para algunos el contacto físico es abrumador, especialmente cuando hay sobrecarga sensorial. Para otros, el contacto físico con una persona de confianza es profundamente regulador y necesario. y para muchos depende completamente del contexto y su estado emocional en ese momento. La clave en todas estas relaciones es la educación mutua y la adaptación. La persona neurotípica necesita aprender sobre autismo. Necesita entender que las diferencias en la expresión emocional no son falta de sentimiento. Y la persona autista necesita también hacer el esfuerzo de explicar su experiencia, de traducir su lenguaje interno al lenguaje que su pareja pueda entender. Cambiemos ahora de escenario y hablemos del mundo laboral, porque aquí es donde veo algunas de las mayores injusticias y también algunas de las mayores oportunidades. Las personas autistas tienen fortalezas laborales extraordinarias que muchas veces son completamente infrautilizadas. Hablemos de ellas. Capacidad de concentración profunda y sostenida. Atención excepcional al detalle. Capacidad para detectar patrones y errores que otros pasan por alto. Pensamiento lógico y sistemático. Honestidad radical, lealtad a la empresa. Cumplimiento riguroso de normas y procedimientos. En ciertos campos, estas características son oro puro. Programación, análisis de datos, investigación científica, control de calidad, edición, traducción, contabilidad. He conocido a programadores autistas que pueden mantener en su cabeza arquitecturas de software increíblemente complejas, a investigadores que pueden pasar días analizando datos con una paciencia que ningún neurotípico tendría. Hay editores que detectan inconsistencias que otros nunca verían, pero el mundo laboral está diseñado por y para cerebros neurotípicos y esto crea barreras completamente innecesarias. Empecemos por el proceso de contratación. Las entrevistas de trabajo típicas favorecen enormemente a personas con buenas habilidades de presentación social, que pueden hacer contacto visual fluido, que pueden leer el ambiente y adaptar sus respuestas, que pueden venderse bien. Todo esto puede ser extremadamente difícil para una persona autista, sin importar qué tan competente sea para el trabajo real. He visto a personas brillantes ser rechazadas en entrevistas porque parecían poco entusiastas, o raras cuando en realidad estaban extremadamente interesadas, pero simplemente no podían modular su expresión facial de la manera esperada, o porque respondieron las preguntas de forma demasiado literal y honesta en lugar de dar las respuestas políticamente correctas que se esperaban. Luego está el ambiente de oficina típico, oficinas abiertas con ruido constante, iluminación fluorescente intensa, interrupciones frecuentes, temperatura que no puedes controlar. Para muchas personas autistas, esto es una pesadilla sensorial que hace imposible la concentración. Irónicamente, las mismas personas que no pueden funcionar en una oficina abierta pueden ser increíblemente productivas trabajando desde casa o en un espacio tranquilo. Las expectativas de socialización también son problemáticas. Almuerzos de equipo obligatorios, afterworks, celebraciones de cumpleaños, conversaciones de pasillo. Para muchas personas autistas, estas no son actividades placenteras de team building. Son demandas agotadoras que drenan la energía que necesitan para hacer su trabajo real. Y aquí está la paradoja. Muchas empresas rechazan hacer adaptaciones simples que harían a empleados autistas extremadamente productivos, mientras pierden talento excepcional o tienen empleados infrautilizados. Las adaptaciones necesarias muchas veces son mínimas. Permitir trabajo remoto o en espacios tranquilos. Proporcionar instrucciones escritas claras en lugar de solo verbales. Permitir el uso de auriculares con cancelación de ruido. Establecer expectativas explícitas en lugar de asumir que se entienden las reglas sociales implícitas. Permitir flexibilidad en horarios para acomodar ritmos circadianos diferentes. He trabajado con empresas que han implementado estas adaptaciones y han descubierto no solo que sus empleados autistas prosperan, sino que muchas de estas adaptaciones también benefician a empleados neurotípicos. Resulta que a mucha gente le viene bien tener instrucciones claras y espacios tranquilos para concentrarse. También quiero hablar del síndrome del impostor, que afecta particularmente a adultos autistas en el trabajo. Después de años de sentirse diferentes y de tener que esforzarse el doble que otros para lograr los mismos resultados, muchas personas autistas sienten que están constantemente a punto de ser descubiertas como fraudulentas, aunque objetivamente sean muy competentes en sus trabajos. Ahora quiero hablar de algo que creo que es profundamente transformador: el movimiento de orgullo autista y la importancia de la comunidad. Durante mucho tiempo, el discurso sobre el autismo ha sido controlado principalmente por profesionales no autistas y por padres de niños autistas. Pero en las últimas décadas ha surgido un movimiento potente de autodefensa, liderado por adultos autistas que están reclamando su narrativa. Y lo que están diciendo es poderoso. No hablen sobre nosotros sin nosotros. Están cuestionando las terapias que buscan normalizarlos. Están rechazando el lenguaje que los describe como defectuosos o rotos. Están celebrando sus diferencias en lugar de avergonzarse de ellas. He visto el impacto transformador que tiene para una persona autista conectar con la comunidad autista. De repente no están solos. De repente hay cientos, miles de personas que entienden exactamente lo que es necesitar silencio después de interacciones sociales, lo que es tener un interés especial tan intenso que puede desplazar cualquier otra cosa, lo que es sentir texturas de formas abrumadoras. En estas comunidades, las cosas que el mundo neurotípico ve como defectos son entendidas y aceptadas. Nadie te juzga por agitar las manos cuando estás emocionado. Nadie espera que mantengas contacto visual. Nadie te presiona para socializar de maneras que te resultan agotadoras. Es como finalmente llegar a casa después de años de sentirte extranjero en tu propio país. Y algo hermoso que he observado es cómo estas comunidades han desarrollado sus propias normas de comunicación, que son mucho más accesibles para personas autistas. Comunicación directa y clara. Uso de indicadores de tono como S para sarcasmo o SRS para serio, para eliminar ambigüedad. Respeto explícito por los límites y necesidades de cada persona. El orgullo autista no niega los desafíos, no pretende que todo es fácil o que no hay luchas reales, pero rechaza la idea de que ser autista es inherentemente algo negativo. Celebra las fortalezas. Reconoce que muchos de los problemas del autismo son en realidad problemas de una sociedad que no está diseñada para acomodar la diversidad neurológica. Me parece fundamental que los padres de niños autistas conecten con adultos autistas, porque estos adultos pueden ofrecer perspectivas que ningún profesional neurotípico puede dar. Pueden explicar qué se siente desde dentro, pueden orientar sobre qué apoyos realmente ayudan versus qué intervenciones pueden ser traumáticas. Pueden modelar que es posible ser autista y vivir una vida plena y significativa. También quiero mencionar el símbolo del infinito en colores del arco iris, que muchos en la comunidad autista han adoptado en lugar del puzzle piece tradicional. El puzzle piece ha sido criticado porque implica que algo está faltando o que hay que resolver un problema. El infinito representa la idea de que el autismo es parte integral de quien eres, una dimensión infinita de diferencias dentro del espectro y algo que te acompaña toda la vida. Para los padres que me están escuchando, quiero dedicar este tiempo a hablarles directamente sobre la crianza de un niño autista, porque sé que puede ser abrumador, confuso y emocionalmente intenso. Lo primero que quiero decirles es esto. Su hijo no está roto. Su hijo tiene un cerebro maravillosamente diferente que procesa el mundo de maneras únicas. Y sí, eso trae desafíos, pero también trae dones extraordinarios si aprendemos a verlos y nutrirlos. El diagnóstico puede generar muchas emociones: negación, dolor, miedo por el futuro, a veces incluso un duelo por el hijo que imaginaron que tendrían. Todas estas emociones son válidas y está bien sentirlas, pero después de procesarlas viene algo fundamental: la aceptación radical de quién es su hijo. Realmente he visto familias completamente transformadas cuando pasan del paradigma de «tengo que arreglar a mi hijo» al paradigma de «tengo que entender a mi hijo y crear un ambiente donde pueda florecer siendo quien es». Este cambio de perspectiva cambia todo. Entender el autismo de tu hijo significa entender sus sensibilidades sensoriales. Si tu hijo tiene crisis en el supermercado, no es porque sea malcriado, es porque su sistema nervioso está siendo bombardeado por luces, sonidos, olores y ya no puede más. La respuesta no es disciplina más estricta, es reducir las demandas sensoriales o enseñar estrategias de regulación. Significa respetar sus necesidades de rutina y previsibilidad. Para un niño autista, los cambios inesperados pueden ser genuinamente aterradores. No es que sea rígido por capricho, es que su cerebro necesita estructuras predecibles para sentirse seguro. Prepararlos para cambios con anticipación, usar horarios visuales, darles avisos antes de transiciones. Todo esto puede hacer una diferencia enorme. Significa celebrar sus intereses especiales en lugar de intentar limitarlos. Si tu hijo quiere hablar solo de trenes, úsalo. Enséñale matemáticas con problemas sobre trenes. Lean libros sobre la historia de los ferrocarriles. Su interés especial es su superpoder, no su limitación. Significa no forzar cosas que son dolorosas solo porque son socialmente esperadas. Si el contacto visual es realmente aversivo para tu hijo, está bien. Puede comunicarse efectivamente sin mirarte a los ojos. Si los abrazos son sensorialmente abrumadores, encuentra otras formas de expresar afecto que tu hijo pueda recibir. Y aquí hay algo que me rompe el corazón cuando lo veo. Padres que gastan toda su energía intentando que su hijo parezca normal, en lugar de ayudarlo a ser la mejor versión de sí mismo. Horas y horas de terapias que se enfocan en suprimir estereotipias o forzar comportamientos neurotípicos. No estoy diciendo que no haya valor en terapias que enseñan habilidades genuinamente útiles, comunicación, gestión emocional, habilidades de vida diaria, pero hay una diferencia enorme entre enseñar habilidades y forzar conformidad. También quiero hablar sobre hermanos. Los hermanos de niños autistas tienen su propia experiencia compleja. Pueden sentir que reciben menos atención, pueden sentir la presión de ser el niño fácil, pueden ser objeto de burlas por tener un hermano diferente. Necesitan su propio espacio para procesar sus sentimientos y necesitan también educación sobre el autismo de su hermano para que puedan ser aliados en lugar de resentirse. Una cosa más para las familias: cuiden de ustedes mismos. Criar a un niño autista en un mundo que no está diseñado para él es agotador. Busquen apoyo, conecten con otras familias, tomen descansos cuando los necesiten. No pueden cuidar a su hijo si están completamente agotados. Y recuerden siempre, su hijo los está escuchando. La forma en que hablan sobre el autismo, la forma en que hablan sobre su hijo cuando piensan que no está escuchando, todo esto moldea su autoimagen. Hablen del autismo como una diferencia, no como una tragedia. Hablen de su hijo con amor y respeto, enfocándose en sus fortalezas tanto como en sus desafíos. Antes de cerrar, quiero dedicar un tiempo a desmontar algunos mitos persistentes sobre el autismo, porque estas falsedades hacen mucho daño y generan mucha confusión. Mito número 1. Las personas autistas no tienen empatía. Esto es absolutamente falso, y es uno de los mitos más dañinos. Las personas autistas tienen empatía. A menudo sienten las emociones de otros de forma muy intensa. Lo que puede ser diferente es la expresión de esa empatía o la lectura de señales sociales sutiles. Pero sentir profundamente el dolor ajeno, eso está absolutamente presente. De hecho, muchas personas autistas experimentan lo que se llama hiperempat.